what is therapy? If you want to find out, then you're going to want to watch this video where I talk about what therapy is and what happens in therapy. So stay tuned. So what is therapy? Therapy is a particular process that involves a progression from point A, where someone is maybe struggling with particular stressors or triggers or problems, and the therapy helps someone go from point A to point B, where they're able to achieve their goals, they're able to build a relationship with themselves, build a relationship with their loved ones, as well as establish themselves in the world, trying to find their purpose. So therapy, otherwise known as psychotherapy or counseling, is a process, a treatment process that helps individuals who are struggling with mental health issues. So whether you're struggling with stressors or whether you're struggling with severe mental illness, therapy can help you. Well, Nikki, what do therapists actually do? Well, that's a good question. And it really depends on the individual. It really depends on the particular therapist. So for instance, myself, I am a psychoanalytic psychotherapist. So what I like to do is I really like to focus on the psychoanalytic psychotherapy. So I bring about and the analysis and interpretations that help patients to build a level of insight by focusing on the unconscious driving factors. So what I tend to do is I work with patients and dive into their resistances. Usually what this looks like is observing and talking about their defense mechanisms and allowing the patient to break through those defense mechanisms in order to bring to the surface these unconscious and sometimes uncomfortable and disturbing experiences, thoughts, or feelings. So that's my particular approach, is a psychoanalytic psychotherapy approach. However, other therapists, such as cognitive behavioral therapists or CBT therapists, tend to work on the premise that individuals hold core beliefs about themselves. And these beliefs tend to induce particular thoughts and feelings. And those thoughts and feelings impact someone's behavior. So there's going to be a certain procedure and a certain agenda that CBT therapists will have. So they will engage in treatment in their own particular way. I like to look at the conscious realm, the unconscious realm, and I like to case conceptualize, which means I like to observe and understand the whole person, not just their beliefs, but who you are as a person. That is so important. How does therapy work? Isn't it just talking? Can't I just talk to my friends? I mean, wouldn't I save myself the hassle and money? Well, therapy is very different than talking to your friends. Yes, talking to your friends can be so helpful, and having those informal supports can help with venting, can help with finding the emotional support, can help with so many different things. However, friends can't help with the treatment. They're not in a position to understand the unconscious driving factors of the mind. Friends are not in a position to understand, or loved ones are not in a position to understand how you break through resistances and how you break through those unconscious threats and defense mechanisms in the mind. So then this way we can bring to the surface those very painful experiences or thoughts or feelings in order to process them, in order to help the individual move forward and to grow. So it's very, very important that individuals who are in a position of receiving therapy are not only getting therapy from a qualified individual, but they're also on board with the particular treatment process. So for instance, if someone like yourself is interested in more understanding about what the driving factors are behind your symptoms, understanding the whys and why I have anxiety or why I have depression and what's going on in my mind, well, then a CBT therapist isn't going to be a good fit for you. And a friend isn't going to be a good fit either in terms of helping you overcome and achieve your goals and get to where you want to be. So in that case, a psychoanalytic psychotherapist like myself is going to be helpful, because then you're going to be in a position to explore your mind and analyze your mind and break down all of those intricacies that make up your mind. And we can look at these defense mechanisms and dive deeper, deeper, and deeper. So that's why it's important to see a therapist and not just utilize your friends or loved ones. So where do I go to get therapy? Well, that is a very, very good question. If you're in the Ontario province, then you can visit us, the Mind People, and we're in a position that we can help and support you by providing more of a psychoanalytic approach. We also have therapists that are trained in CBT as well. So if you need those coping strategies and you want to establish your toolbox because this is maybe your very first time in therapy, then that's where we begin. If you're not in a position to have that level of insight or to work from that particular treatment model because maybe it's too soon, then that's okay. We're going to begin with where you are at. So if you're in a position of reaching out to us, the Mind People, then you can book online at www.themindpeople.ca. If you are outside of the province of Ontario and you are maybe outside of the country of Canada and you live in a different country, then my recommendation is to go on to Psychology Today. Psychology Today offers a phenomenal resource where you can actually, based on your location, choose which particular therapists fit and work with you. So you can see their profile, you can see what their techniques are, you can see what populations they serve. They have a bit of a bio, so you're able to read about them and their expertise. And what is really important is you are able to see their license number. So then you know that individuals who are on Psychology Today, like myself, we are licensed professionals. You can see our license on our profiles. And you can also visit the college or licensing board, depending on which country or which province that you're in and what the regulating body is. People can visit that particular licensing board. So in Ontario for psychotherapists, that's a College of Registered Psychotherapists, and you can see the list of licensed psychotherapists as well. So if you ever have an issue where you're wondering if this person is licensed and you're wondering if you're actually getting the treatment that you need and deserve, you can always go onto the website. So if you're in the US and you're in a particular state, then you're going to go into the state licensing board. And you're going to look up your therapist. And if your therapist is not there, then you might have an issue. You might want to contact that licensing board. You might want to, reach out in order to get that support that you need. And that might mean, like I said, contacting the licensing board and contacting them, letting them know that so-and-so is maybe providing therapy, but I don't see their license on this particular licensing board. It might just be there on a different board. So for instance, psychotherapists in Ontario are registered with the College of Psychotherapists of Ontario. However, therapists are also, come in the form of social workers. So some social workers are part of the College of Social Workers, not the College of Registered Psychotherapists, but can provide therapy. So that's a little bit confusing. However, there are situations in our positions where people, depending again on your country, depending on your state, your province, that might be in a position to provide psychotherapy, but might be licensed with a different organization. So keep that in mind. Ultimately, you want to ensure that the therapy that you are receiving is not only a good fit for you, but you are also being taken care of by a professional, by someone who is a licensed professional and knows what they are doing. Because if that is not the case, then we want to report this particular person because unfortunately there are some people out there who are practicing without licenses, and that is a big, big no-no when working with vulnerable populations. Okay, so in this video, we talked about what therapy is, what therapy isn't, and why we don't go to our friends for therapy. You also know where to go. So if you're living in Ontario, you can visit us online, again, at www.themindpeople.ca, and you can book an online complimentary consultation with any one of our associates. And if you're outside of the province of Ontario or outside of Canada in general, then what you can do is visit Psychology Today and you can look up the most appropriate therapist for you. You can filter and see who is a good fit. I want to thank you so much for joining me in today's video. If you liked this video, please give it a thumbs up and subscribe to my channel. And be sure to watch out for the next video where I talk about motivational strategies. Thank you for watching and join me in this video next.